with me for a little while. Some of it will be review at the beginning, and you'll understand why as we go through. And then we're going to branch off into some of the more specific things. So hopefully for those who have not been with me before, this will help you catch up and understand where we're at. And people who have been with me, it'll be a very good way to solidify the information and make you understand a little bit more about why we're here and why I do what I do and why all of you can benefit from all of this. Tonight is going to be a lot on stress. Okay, how many of you in here would say that stress affects your life in some way? Okay, I would say all of us, right? In some form or another, I've been dealing with it throughout life. And as a practitioner, I've seen it, how it affects people. And one of the most, I would say, impactful patients I saw, this was maybe about 7 years ago when I worked at York University. She was 25, 26 years of age, and I was treating her for about 6 to 8 weeks. And every day she came in, this is what I would see. She'd come in and she'd literally grimacing on the face, and she would sit down, excruciating pain. And we would treat her, and maybe she was getting 10% better, maybe 15% better, but not a whole heck of a lot better. And one day I sat her down, and we sat eye to eye, knee to knee, and I said to her, "What's going on? There's something else going on." And she said, "Well, what do you mean?" I said, "Well, there has to be something else going on, because it doesn't seem like there's a real big physical reason for what's happening here, and you are in excruciating pain." So I said, "Is there something that you're holding on to?" And she looked at me and she said, "Yeah." And I said, "Well, you don't have to share with me what it is if you're not comfortable, but you have to be able to let go of it." And she said, "There's no way I can let go of it. I feel way too guilty." And I said, "Well, you're keeping yourself in some kind of prison if you're not letting it go." And we kind of let the conversation go. I didn't want to push. It wasn't my place. She didn't come to me for that specific reason, so I didn't want to push. But 2 days later, she came back, and this is what I saw. And she sat down on my table. And I said, "1 minute here." She goes, "What do you mean?" I said, "We're not doing anything today until you explain to me what happened." She goes, "I don't understand what you're talking about." And I said, "You just came in and you sat down, and for the first time in 6 weeks, you didn't grimace in pain. What happened?" So she said, "Well, I went home, thought about what you were saying, and I thought about the issue." And she said, "I began to tear up a little bit." And I said, "That's it?" She said, "Yeah." I said, "Well then, I might want to adjust you today, but I also suggest you might go home and watch Bambi so that you really cry and let it all out." She was 80% better, literally just from tearing up a little bit and thinking about the issue. And it really hit home with me, with some of my own personal stuff and with some of my patients. And literally yesterday, I've been treating a woman, really bad knees, really bad back, really bad neck, and I keep telling her that this can't all be physical. And she's a teacher. She has to bend down to get up with the kids and everything else, and she's literally been getting worse over the last 4 months. And yes, this was yesterday. She's actually supposed to be here. I probably wouldn't be telling it if she was here. But she came in and she sat down and she just looked lighter. And her daughter was with her, and I said, What was this?" And I go, "Why? Because school's almost over? You're not working?" She goes, "No, I got a job for the summer, and I'm going to be working for the next 3 years, and they gave me a contract." And she was excited, and I go, "How's your pain?" She said, "Much better." Now, this is a woman I had a very hard time convincing that she didn't have arthritis in the knees. I took X-rays. The X-rays are perfect. So I'm seeing this every day. I mean, last week a woman came back from vacation, weak arm, pain down the leg, all kinds of different symptoms, carpal tunnel type symptoms. She went to Cuba for a week. She came back, this was 2 days ago, and she said, "I felt no symptoms at all when I was on vacation." She came back, the second that she got back, she opened the door to her house, all the symptoms came back. So I'm not saying there is not any physical basis to anything that we're dealing with, but this is happening over and over and over again. So there has to be something else going on. Okay? in my own personal journey, the first time I went to see a lecture on anxiety, I was 18 years old. I dealt with regular insecurities as a teenager, but I got severe anxiety when I was 18, 19, and 20 years of age. And I dealt with it and was up and down throughout chiropractic. I remember being an intern and trying to treat people and getting severe anxiety due to all kinds of things. And then I got married in 2002. And by 2005-ish, right around the time my first child was coming, anxiety went through the roof. I felt poison in my body. And the only time it felt better was really when I was really focused. And we're going to be talking about some of that tonight, of some of the things that I did. But it was horrible. And the one thing that I learned is that this is going to be a process. But I needed to change my life around in a big way. And literally for me, in the last year or so, maybe 2 years, things have taken a massive change. And I swore that as I was going through it and as I was dealing with it, that I was going to share it as soon as I was able to come out of it and go, okay, I have some answers here for some people. Because I doubt that there's anybody in this room that I couldn't identify with, that I couldn't be able to talk to and say, I get what you're going through, or that some of your relatives are going through. We all deal with this stuff in some sort of way. So tonight we're going to be discussing stress. We're going to be taking it from what I consider the core of what you have to heal first, because I believe some of you in this room have done all kinds of different things, but there's an order of events that you have to do. And once you understand this, it's all going to build upon each other. So, the purpose of tonight is A, to understand physical, chemical, and emotional stress, how it affects our body, how it affects our nervous system. The second is for you to be able to learn how to manage it and leave tonight with some practical things that you can start looking into. And then 3, to be able to share this with people, because if you're anything like me, I wanted to jump off, and tell the world all of this. I wanted to get out there and scream from the top of buildings and say, this is what I figured out. And that's why we're here tonight, is so that I can share some of this with you. So how do you perceive stress? Some people it's money, sometimes it's just work, divorce, losses. Everybody's got their own way of perceiving what anxiety and stress is. But it doesn't matter, because it's all about you. You know, I've had people say to me, well, just be glad that you're not in a wheelchair. I've seen people in wheelchairs with huge smiles on their faces and they love life. It doesn't take away of what you're going through. You could be wealthy, you could have the greatest marriage, you could have the greatest job. It doesn't take away from what you're going through, because we all perceive stress differently. Okay? But the consequences of stress are devastating. They affect every ounce of every cell of your being. We're going to talk again about the Windsor autopsies, but this was a medical doctor in the early 1900s, 1930s or 40s, and he did autopsies. And what he found was 96% of diseased organs were directly related to stress. Okay, 96%. Okay, so the choices that we make today obviously affect tomorrow. And it becomes a spiral one way or the next. And the choices that we make today obviously affect how we will live tomorrow. And if we don't start living a healthy lifestyle, then we're going to get the typical North American outcome, which is stress, which is heart disease, which is depression, cancer. Okay. So health is not the absence of symptoms. Okay, health is optimal function. Let me give you 2 examples, because I have people all the time, even after being with me for 6 months to a year, I'll give them a questionnaire, and we'll say, how do you know you're healthy? And they'll say, because my symptoms are gone. And these are people that I've talked to again and again about function. Okay? In the 80s, when I do these lectures, I used to talk about Sergei Grinkov, who was a figure skater. I think it was the 80s, he went to the Olympics. And literally, while training for the Olympics, he dropped dead of a heart attack. And the day before, if you would have asked his family if he was a healthy person, they would have said he's the healthiest person that they know. But literally, his heart was this close to death, right? But now I can just speak about my father, who at 53 years of age was in very good health, and he had a heart attack. Now, he's still alive, thank God, and he's doing very well, but the day before his heart attack, he had no clue. He had no symptoms. He thought he was very, very healthy. And at 53 years of age, he had a heart attack. But let's take the opposite edge of the coin. Let's say one of you go home tonight, have a chicken sandwich, and you spend the rest of the night throwing up. Would you go to work the next day and tell everybody that you were healthy last night or that you were sick? Most of you would go to work and say, I was sick. But if you were sick, what would have happened? If your body was really sick, what would have happened? You would have died. Because what was in the chicken? Salmonella. Or some type of food poisoning. Okay? So what did your body do? It rejected it. So was your body healthy or sick?
Healthy.
It was healthy, right? In one case, we have someone who appears to be the, picture of health, and they drop dead of a heart attack. And in the other, you have someone who is vomiting all night but is very healthy. Okay? Health is not the absence of symptoms. Health is optimal function. It's the way your brain communicates with your body. Okay. Those of you that have been with me, we've gone through this over and over and over again, but it bears repeating. Your brain is at the top. From your brain, you have the spinal cord. It goes down the spinal column. Out of the spinal column comes the spinal nerves. Okay? Those spinal nerves go to every part of the body. So for your heart to beat, your lungs to breathe, your intestines to digest, you need these messages to be pumping there without any interference. Okay? Now, let's say there's damage right here. Maybe you've got some neck pain, maybe you've got some back pain, maybe you've got poor posture. Where else can there be damage? The heart, the lungs. Okay? I'm not saying that every person that has poor posture or damage right here is going to have a heart attack. But that's why it's so common in people with poor posture. That's why these things happen to these people. It's a big part of the puzzle because of the stress that it's putting on the nervous system. Okay? It affects every part of your body. Our nervous system is responsible for processing and filtering all the stress that we deal with. And it's the ability of our nervous system to adapt to the stress coming in that determines how healthy we are. Okay? So we're dealing with three main types of stress that we're going to talk about in general. There are more types. There's electromagnetic stress, but we're not going to get into that at all. The three main ones that we're going to deal with are physical, emotional, and chemical. And tonight we're dealing mainly with emotional. I'm just mentioning the other two because you can't really talk about stress without at least mentioning the other two. So physical. Physical literally starts from the second you're born. If you've ever seen a baby being born, they're pulled and twisted and stretched. Okay? My kids were adjusted on the table that they were born on. I watched as the doctors yanked, pulled, twisted. I saw my daughter's nose was like this and she had a black eye and she was stuck on the pelvic bone. And when I told the medical doctors I was about to adjust my kids, they looked at me in horror. They've obviously never seen someone adjust a baby. You use your pinkies, and what we were doing is just making sure that C1, the very first vertebra, which is the most important vertebra in the spine, is attached to the brain stem. If it's being stretched and pulled, it can affect the entire child. So I adjusted them on the table they were born on. And when the doctors looked, they went, oh, okay. Wasn't a big deal. I mean, I just used my pinkies and it, maybe about 2 ounces of force. Of course, car accidents, sport injuries, slips, trips, falls, sitting at your desk all day, physical stress. Okay? Over 80% of normal childbirths result in injuries to the neck. And that's because of pulling, twisting. They're not doing anything wrong. It's something that they have to do. But this is why it's so important to check your children literally the second that they're born. We're not going to deal with most of this tonight. Emotional stressors. We're going to be talking a lot about this as soon as we finish the first part. But when we're talking about the nervous system and how it binds up your energy, at York, which is where I was at, I practiced at York University for 14 years in the health clinic there. And I managed students and faculty. There was a student that came in, and she came in for neck pain and headaches after her boyfriend referred her in. And she came in, and the first adjustment I gave her, I adjusted her neck, and within 5 seconds she was bawling her eyes out on the table, crying uncontrollably. Now, as a chiropractor, I don't want to see that. It scared me. I don't want anybody crying on my table, and quite honestly, all I saw was a lawsuit. I didn't want to deal with it because I didn't do anything wrong. But her boyfriend was in the room, and her crying turned to laughter very, very quickly. Because it turned out that she hadn't cried in 10 years. What she related to me after that, and her boyfriend was right there going, yeah, it's true. She had been depressed for 5 years. The day before, she worked in Second Cup. She had been in the back room. She locked the back room. She was there trying to cry because she was so anxious and uptight. She couldn't cry. I adjusted her C1 and her C2, and in 5 seconds she started bawling her eyes out. So she was laughing because this was the release that she had wanted and could not give to herself. So not only did her headaches go away, but a lot of things started to clear up. Okay, so the nervous system does what it needs to do, and emotional stressors are just the same as any of the other stressors onto your body. Okay? Over 20 million North Americans suffer from stress-related disorders, and since there's, 400 million people or so, I think that number is far underreported. I would say it's more in the 100 million people that just, they don't talk about it. Most people don't talk about it. Okay, chemical stressors. We're not going to really discuss chemical stressors tonight, but it's everything we put in our body, from standing at a bus stop to all of these different things that we put in our body, chemical, physical, and emotional. Okay? So what is the difference of physical, chemical, and emotional and how they affect your nervous system? Nothing. They all do exactly the same to our nervous system. It's the way our brain has to process it and adapt to it, and it's forcing your body to adapt all the time. They do the exact same things. So when people come in, it's very easy to understand that sitting at your desk like this is going to cause you headaches, or sleeping like this can cause you headaches. But chemical and emotional will do the exact same things. It's just not as easy to explain, but when you understand that the brain has to adapt, it's all the same stuff it has to adapt to. It's all stress. So the brain sends messages down the spinal cord. Those messages exit the spinal cord through the nerves, and they go to every part of the body. Again, for the heart to beat, the lungs to breathe, you need those messages pumping there. But sometimes, and those of you that have been with me know this, when the vertebrae misalign, or they're not working properly, they're not moving properly, they start to put pressure on the nerves, damaging the nerve. And not only does it damage the nerves, but it damages wherever those nerves go to. And that's called a subluxation. Subluxations will not only damage the nervous system, they damage wherever those messages go, leading to ill health, disease, and early death. Your body cannot function as well as it should. Subluxation over time breaks down the body. Now, for example, in my doctor's report that I do, I often cite an example of a woman who comes in with bladder infections. But just about a month ago, I had another one that had to do with constipation, so I'll use that example. This person suffered with constipation for years, had done all kinds of medications, had done all kinds of different doctors, but they came to our doctor's report for back pain. I did x-rays of the spine. The lower back x-rays were fine. Okay? The lower back nerves are the ones that go to the intestines. So you would think that if the lower back is fine, it wasn't a spinal issue. But then we took x-rays of the neck, and just like the lady with the bladder infections, the neck was terrible. So we put him under care, and literally within 6 weeks, no more constipation. Okay? Why? Because the power is now turned back on. The power was being compressed. Once the body starts to heal, the messages start to get through, the body starts to heal. Okay? That's what our job to do, is to prevent this deterioration from happening, to maintain the integrity of the nervous system by maintaining the curvatures of the spine. And as you'll see in a minute, the neck is the most important part, because there's a space inside of it that allows the messages to get through. Okay, so why would stress have anything to do with constipation or bladder infections? Internal adaptability. When you have unhealthy neurologic patterns, in other words, your body's overwhelmed, it can no longer respond to the stress it's under, and therefore you don't have the ability to fight those stressors, and it comes out in some form of disease or dysfunction. Okay, so subluxations are these unhealthy neurologic patterns. It's an interruption. Okay, how many of you remember Christopher Reeves? Okay, we talk about Christopher Reeves quite a lot because people remember him. Okay, he fell off a horse and became paralyzed, right? He was a quadriplegic. He had no use of his arms. He had no use of his legs. Okay, but when he fell off the horse, okay, well, sorry. What did he need afterwards? He needed something to help him breathe. He needed something to help him evacuate. He needed something to help his heart beat, right? But when he fell off the horse, what did he hurt? His spine. A piece of bone the size of my pinky went into his spinal cord and severed it. The messages were cut off. Now, with a subluxation, do the messages get through? Yes, but not completely. It's interfering. The analogy I like to use is it's like stepping on a hose. The water has to trickle out. Okay? That's the difference. We're not talking about complete paralysis, but over time it's being choked off. But it's the same process, okay? And that's why we talk about it. Okay, so when we talk about subluxation, and the reason that it's relevant to what we're talking about, it interferes with your body's ability to express human potential. And that's what we're talking about, is your body's ability to heal. Okay, so the Windsor autopsies. This is what I talked about in the early 1900s. Not only were 96% of the diseased organs related to stress, but 96% of the time it was the nerves that communicated with them that were affected. Okay? This is happening all the time. People are dying of diseases. Now, when you go into a medical doctor's office, most of us present, we think we have a bladder problem, or we have an intestinal problem, or we have a heart problem. And that may be true. But in our office, what we find is over 90% of the time, there is a spinal connection. There is a part of it. The piece of the puzzle is the spine. So at York, I worked with maybe a dozen medical doctors, and here we're starting to gain relationships with the MDs in this area. And when you start to talk to them, and you have these conversations, if you use their language and you speak to them with their lingo, they get it. And then all of a sudden, we start seeing them referring their wives and their kids and themselves. They come in and get checked, because it starts to make sense. But most of the time in a medical office, they're looking for a bladder problem or an intestinal problem, right? But we know that that's not the case. And more we're seeing that as science is proving of what we're talking about. Okay, so our nervous system literally controls every cell and every tissue of the entire body. But how do we know if we have these bad patterns? We don't. Okay? So the idea is, the first thing that we want to do is get our spine checked. Boy, you're good timing. Very good timing. We get our spines checked. That's why we do what we do. Okay? A wellness-based, neurologic-based chiropractor is checking the nervous system. Of course, we want to help you with back pain, neck pain, headaches, and the like. But what we're really doing is checking your nervous system. Okay? It's the only way to know. Now, in our office, we use the first thing we do is something called a thermal scan, which is over here. It is not a diagnostic tool. What it does is tell you metabolically, is there stress going on in the nervous system? So green is mild, blue is moderate, red and black are severe, off the chart stress. We don't want to see it because what it indicates is there's some type of damage. There might be arthritis going on, there might be bone spur. But it's not conclusive. It's just the first thing we do to get an indication. Now, any of the guests here tonight that have not had a scan before, some guy is here, or Rob, whoever wants to do it. We've got it set up. It's completely non-invasive. All it's doing is measuring heat coming out of your nervous system. We're only doing the neck, okay, so we don't have to get anybody out of clothes or anything like that. But if you want, during the rest of the presentation, trickle over. All you got to do is sit here. She's just going to scan your neck, and you'll be able to just get an indication of what type of stressors are going on. Okay, so some guy, if you want to come over and just get it all set up. And during, I can answer any questions afterwards, but really don't freak out if you see it. It's not diagnostic. What it's doing is just giving us an indication of how much stress is going on in the nervous system. Okay, so if you've never had one done, it's very, very easy. I encourage you to come up. I'm not going to be, interrupted. You can go around the back, the sides, the front, but I encourage you to just go over and get it done. If you want to just maybe start at the back row, and then we can just move up. Anybody that's never had a scan, feel free. Otherwise, just make your way up during the presentation. Okay, posture. I talk a lot about posture. Okay, why? Because posture is the window of your spine. Okay, and when you look like this, or you look like this, or you look like this, we know that there's damage in the nervous system. Okay, now if you're 71 and you look like this, when did that start? It started when you were a child. Okay, and that's why I adjusted my kids when literally they were born. Because next thing you know, they have colic, ear infections, then headaches and migraines later on. And it's all preventable. Okay, so I don't want that for my kids. I certainly don't want that for your kids. In our office, we check all kids. Doesn't mean they need adjustments. Some of them they do, some of them we don't. But we check them all. Okay? Because there's no way of knowing unless they get checked. So, normal healthy posture. The plumb line should go right through the ear, right through the shoulder. Okay? Because otherwise, if it's doing this, you're putting pressure on the nerves that go to the heart, the lungs, and everything below it. And of course, we want to be level on all the other planes. I think this person has health problems. Okay, this is forward head carriage. Okay. One of the studies that we talk about in my presentation in the office this is one of the studies that got me really interested in this. This is in your handout. And if you look at the back page of the handout, it shows you the study. It's from the Journal of the American Geriatric Society, one of the most reputable journals in medicine. And literally what they did is they took 1,400 subjects, they measured their posture, and they watched them. And what they found is that if you look at the conclusion, it's at the very bottom, okay? People with hyperkyphotic posture, okay, they die earlier. Okay, this is not a chiropractic opinion. This is a medical opinion done by a very reputable journal. Okay, your medical doctors have seen this information, but if they knew already what to do, they would have already sent you for an X-ray to make you understand how important this stuff is. Okay, and if you look at the line above it, at the very bottom, just above the conclusion, it specifically says that the death is related to atherosclerosis, heart disease, stroke, heart attacks. Okay, atherosclerosis. Why? Because if you remember on the diagram, the very base of the neck, that goes to the heart and lungs, and if you look like this, you're getting pressure going to your heart and lungs. Before I go on, we've had many people that have come in with heart problems, high blood pressure. And there was one that he was in his late 60s, mid-60s, and he came in, he'd been on high blood pressure medication for 7 or 8 years, all kinds of stress. He never lost weight, he never did exercise, but once we started him going through a corrective protocol, within 8 months his medical doctor told him to get off of his medications. Okay? This doesn't happen to everybody with high blood pressure, but it will happen to all different kinds of things. indigestion, constipation, bladder infections, high blood pressure, because the body tends to heal itself. Okay. X-ray. We've done thermal scans, we've talked about posture. X-ray is the only way to know what you look like on the inside. Who here has never seen a chiropractor? Okay. Most of you have that. But there are different types of chiropractic, as most of you know then. There is regular chiropractic, where essentially if you go in looking like this, you come out looking like this. And then there's something called chiropractic biophysics, which is what we're doing in our office, and which is why we're getting so busy over the last couple of years, because if you come in looking like this, our goal is to get you here. It's not perfect all of the time, but we're going to get you as best as you can be, and we're seeing phenomenal results. Okay? And it's affecting everything. And the reason I'm using this as a segue is because as I started this presentation by telling you, is that only in the last 2 years things have started coming around for me. And I have done every stress, every anxiety, every therapist, everything that you could think of. I've been there, I've done it, I've chosen to try everything. Energy healers, you wouldn't believe some of the things that I've tried. But until I started correcting my nervous system, none of them were effective. No diets, no supplements, no medications, none of it. Because once this is corrected, the body starts to heal. And I personally have seen this, and I've seen going. Now this is a normal. This is where we want to look. A nice curvature. This is the spinal cord. There's space between the vertebra and the spinal cord. Okay? But when you go through different phases, phase 1, as most of you know, takes 10 years to develop. What it's doing is that, you see how it's narrowing through here? Okay? The spinal cord's getting squeezed. And as the spinal cord is getting squeezed, the information's getting cut off. Okay? It's like a banana. If you straighten that banana, it starts to break and ooze out, because if something is meant to be curved, there's more space inside of it than when you straighten it. Phase 1, they don't have arthritis or bone spurring yet, but they're on their way. Now this is phase 2. Straight and forward. Can you see these bumps here? Okay? Hard to see on here, but these white spots here are bone spurs. When you see bone spurs on X-ray, this is what's going on to the spinal cord. This is what was going on with me. This is why I'm starting the presentation talking about this stuff. Because if you look like this on the inside, your body can't function properly. Okay? The scary thing about this is you don't know you have it. What's the only way to know if you've got this?
X-ray.
X-ray. That's why I got my X-rays done. That's why I've gotten all of you to get your X-rays, because you don't know. I was doing everything. And if you try everything, from yoga to Tai Chi to meditation to medications to supplements, I don't care what you try, you will not get the success that you're supposed to have if you look like this. When you go from here back to normal, your body starts to respond better. Okay, I hope that makes sense, because that is exactly what needs to happen for all of you. Okay. I showed this very quickly. This is phase 3. The vertebrae are fusing, and the spinal cord is literally degenerating. We can't help you if you're in phase 3. You're already fused. I don't want you waiting till you're in a phase 3, because there's nothing we can do about it. Okay, so is subluxation reversible? Absolutely. The adjustments that we do, the protocols that we're under, okay, we can talk about that later, but that's exactly what we do. And then once you have better internal adaptability, because the power has turned back on, we have to maintain it. In our office, we've got a maintenance program, but all the stuff that we're going to go over now is what is the stuff that has to keep increasing your internal adaptability. Okay. So the absolute key to eliminating disease is how well an individual can manage the 3 types of stress. Okay, so we've talked about the 3 secrets. We're going to talk about the 3 secrets. The first one we just talked about. Get your spine and nervous system corrected. Okay? It's like I'm the hair club for president, hair club for men president. I'm not only, a user, I'm also the president. You have to do it before your body can respond properly. Okay? So that's secret number 1. Now, Secret number 2. I don't know if all of you have pens or paper, but if you do, this is where I want you to start taking some notes. This is probably the most beneficial thing to start my process, okay? You're all starting your journey, and you have to start it properly. Step number 1, identify all incoming stress. Everything, whether it's your mother-in-law, whether it's your job, whether it's the food you eat, whether it's your friends, whether it's your family, every single stressor. Your list might be 150 long. It doesn't matter. If you can't identify it, you can't get rid of it. Okay? Identify everything. Make the list, spend the time. Don't rush it in an hour. Take your time and do this. Write down every single thing that is a stressor in your life, incoming. Now we're going to double that list, because now you're going to identify every single thing that's happened in your past. If you feel that your stress happened from birth, put it. If you feel that your stress started as a teenager, put it. If there was something that happened physically, chemically, or emotional, put it. Every single one of them. You may have 300 things on your list. It doesn't matter. You can't get rid of it if you haven't identified it. So put it all down. I encourage you to do this as an exercise. It'll be eye-opening for you. The next thing to do is to reduce or eliminate it. So that means that if you've got 300 things on your list, you have to have a plan for every single one of those 300 things. Now, some of them might be similar, so you can start knocking them off 10 at a time, 15 at a time. Some of them might have to do with diet. Some of them might have to do with exercise. Some of them might have to do with therapy. Some of them might have to do with reading a book. And some of them might have to do with all the stuff that we're going to bring up now one at a time. But the idea is to have an idea of how to reduce or eliminate every single thing on your list. Okay? And then secret 3 is increase your capacity. Okay? Those are some very general things. But I want you to understand a couple of things. I believe that in the next 15 to 20 years, medical science is going to look back on everything that we've done up till now and think that we've just done everything completely wrong. Our brains are firing in a certain way due to the patterns that we've all been accustomed to. Okay? Who here understands the fight or flight response? Okay? Your body, when you get scared or nervous or have stress, it produces adrenaline and cortisol and your body's running. Because 1,000 years ago, or longer, if there was a bear chasing you, you had to run from that bear. Your body's responding appropriately. But now, we're still running and there's no bear. Our brain is firing and it's having this response. And then what do? We go into a cycle of what's wrong with me, I shouldn't be like this, and we start beating ourselves up over it, and then it all magnifies on top of each other. Okay? In our brain, there are 4 different types of waves: beta, alpha, theta, and delta. You're not going to get tested on this. But each hemisphere of your brain is firing in a specific order and a specific pattern. But because of the way we've thought, because of the way we think currently, those firing patterns are thrown off. Okay? Those of us who have tried medications, those of you who are currently on medications, antidepressants, anxiety drugs, what they're doing is trying to attack the frontal lobe, the different lobes and different serotonin receptors, GABA receptors, acetylcholine, all of these things that make the brain run. But the reason that these drugs don't cure you or get rid of all of this is because every time you add something to the system, there's going to have to be a reaction. Every action has an equal or opposite reaction. Because you're not really changing the way your brain is firing. We have to get the brain to fire completely different by creating different patterns in our life. Okay? The first thing that, let me just make sure it was the first thing. The first thing that I wanted to talk about was mindfulness. Who here is aware of mindfulness? Okay? Mindfulness seems to be the new, I guess the new meditation. Okay? But I can give you a very easy definition, one versus the other. In meditation, people get frustrated because they can't calm the mind. They sit there for an hour and they cannot stop thinking, so they beat themselves up, and in the end they're actually worse. Mindfulness states your brain is supposed to be firing, and especially if you've got these improper patterns, your brain is going to fire all the time. But in mindfulness, you're just supposed to be aware of it. Awareness. You're just supposed to be aware that your brain is firing. Okay, I'm not freaking out, I'm not different, I'm not bad, my brain is just firing badly. So the way it was explained to me is pretend you're watching traffic. When you're watching traffic, you don't look at each person in the car and worry about what they're doing in their car, you just let the traffic go by. That's what mindfulness is to your thoughts. If you're sitting there being mindful, you don't stop your brain, you just let the thoughts go by. You don't give them energy. Okay? Two of the biggest things that affect being mindful. One is that we're all searching for validation. We all want to be validated by ourselves, we all want to be validated by someone else, and we all want to be validated in life in general. Instead of just living our own journey and being who we are, we want to be validated by others. It's natural. The second is comparing ourselves to others. We have no idea what anybody else is thinking. The way someone treats you, the way people respond to you, the things other people do is always, always, always based upon them. It has nothing to do with you. But yet, we compare ourselves to others. You know, it's amazing. You think people who are Hollywood stars have it all made, and then you hear one of them's getting a divorce, one of them died, one of them this, one of them that, one of them is checking into rehab. Nobody's different. We're all the same. The problem is we're all walking around thinking that we're not the same. In mindfulness, it basically brings you back to your own journey. Okay? There's an exercise that I'd like you to write down that you can do at home. You know, I might put on workshops later where we do some of these, but anybody in here that has anxiety, back pain, some type of symptom that they can identify, I want you to sit in a room, quiet, by yourself, and I want you to focus on that symptom. Don't try to ignore it, don't try to push it away. Think about it, and just feel it. Identify where you think it is, and then even narrow your focus down even more. Okay, so if I'm feeling anxiety here, and I'm just going to sit and think about the anxiety here. And then I'm going to say, okay, where is it? And I'm going to try and focus more and more on that spot. In your mind, go deeper and deeper into that spot. What you will probably find is that it doesn't exist. It's not there anymore. And it keeps shifting. Oh, I thought it was there, but now it's kind of here. Now it's kind of there. Why isn't it there anymore? It's kind of over here. It's not a thing. It's our perception of it. And it's very interesting when you start doing this. And sometimes it just goes away. Other times it doesn't. But the idea is that you're just aware of it. In Boston, and I forget which university it is. It's either Stanford or Boston University. I forget which one it is. They just opened up in the last several years an entire program on mindfulness and the science behind mindfulness. You are changing your brain just by being aware that you have symptoms, that you are thinking about something. And to confuse you even more, because this is such a simple concept that gets complex, if you are aware of yourself being aware, that changes your brain even more. So if you in your mind's eye can picture visualizing yourself being aware of where your symptoms are, you're creating new brain patterns. It's called neuroplasticity. It's the hottest topic in neuroscience. It's what everybody is working on now. But the more aware we are of what we do, and how we are, and how we interact, without judging, just sitting with ourselves in a situation. In a practical sense, you can do it like meditation. You can sit in your own room and do it. But in other senses, you can, just during your day, you feel yourself getting anxious at work. Instead of going, oh, now I'm anxious, my rest of my day is going to be horrible, and you spiral, Instead, step back in your mind and go, okay, I'm anxious right now. I feel it here. Okay. I know it's going to get easier later. I know I might deal with this for a few days. Or I know this is going to go on for another month, but I dealt with it yesterday. I'll deal with it tomorrow. Okay? It's interesting. I'm feeling it. Don't fight it. Don't fight yourself. I'm not saying it's comfortable, and I'm not telling you that this is easy to do, because it's not. I'm a very beginner at this, and I've been doing it for a few years. Okay? This gets deeper and deeper and deeper. But one of the messages I want you to take out of tonight, that if you never start doing this stuff now, you'll never get to where you want to be in 5 years.